Hi, everyone. Good afternoon and welcome to our Think Trauma curriculum learning session. My name is Isabel Kai-Fisher, and I'm a project assistant with C4 Innovations and the New England Mental Health Technology Transfer Center. So I just want to give you some housekeeping information before we start today. Participant microphones will be muted at entry. You will be able to unmute your microphone at designated times during our event. Closed captioning in Spanish is available for this event. Click on the closed captioning icon at the bottom of your Zoom screen to select a transcription option. This session is being recorded and it will be available on the MHTTC website within 48 hours of the close of this presentation. If you have questions during the event, please use the chat or the raise hand feature. Our technical support manager will ensure your question concern is addressed. You can also just reach out to me, private message me, and I'll get back to you ASAP. And if you have any questions after the session, please email newengland@mhtTCnetwork.org. Next slide, Rocio. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. That language is strength-based and hopeful, inclusive and accepting of diverse cultures, genders, perspectives, and experiences, healing-centered and trauma-responsive, inviting to individuals participating in their own journeys, person-first and free of labels, non-judgmental and avoiding assumptions, respectful, clear, and understandable, consistent with our actions, policies, and products. All right, so I'm going to turn it over to Maria to introduce our presentation. All right, thanks, Maria.
Thank you so much, and good afternoon, everybody. My name is Maria Restrepo Toro, and I am the co-director of the New England Mental Health TTC. If this is the first time you're joining us, we welcome you. Just to orient you on what this network is all about, we are 10, there are this type of technical assistant trainers are around the country, and we are in Region 1 here to provide training and technical assistance on behavioral health practices. So it is a pleasure to welcome you all. Well, Rocio, next, please. I love to see people for so many people. Then our New England Mental Health TTC, we are really invested in promoting recovery-oriented practices that you're going to be using today. I'm hearing a lot about that today. We believe we are here to support the entire region and will bring issues that are relevant for the region and perhaps many other places in the country as well. We also are very committed to inclusion. We work very actively and develop and maintain a network of people that are, with lived experience, officials, policymakers, family members, and we are committed to racial equity in all our activities. Next. The grounded principles of our mental health TTC are very related to today's presentation. We are all about promoting practices these are our guiding principles, and we know recovery emerges from home. Recovery is person-family centered. There are multiple ways to recovery and holistic. And I want to point out that also we know that resilience and recovery are supported by addressing trauma, which is what we're here today. So all the presentation will be available after the presentation, and we ask you at the end, you will be provided with a link to evaluate. It's very important that you complete the link. So now it's my pleasure to turn it over to my colleague, Graciela Reese, from also the Yale Program on Recovery and Community Health.
Thank you, Maria. It's my pleasure to introduce to you. My name is Graciela Reese, and it's my pleasure to introduce to you Dr. Rocio Chang. She works at Spirits Institute at Yukon Health. I'm so glad that you're here with us today, and we're very welcome as well. Doris Maldonado Mendes. She is here to present Mental Health Connecticut. Welcome to Doris. And Dr. Rocio, the floor is yours.
Many thanks. Thank you so much for the invitation. Doris and I are very grateful to have the opportunity to give you a taste of the Think Trauma curriculum that has been co-developed by many wonderful colleagues from the National Child Traumatic Stress Network. And even though this curriculum intended to focus on justice-involved youth, I believe that it can be easily adaptable to other populations. And as a matter of fact, I have used this curriculum in the educational field. I have also used it with adults and in other different contexts. So in this hour, what I will be doing is giving you some overview about what you will get if you are if you are interested in pursuing and learning more about the curriculum at a later time. So and I know that my colleague Doris Maldonado will join us a little bit later to answer any questions. And since I cannot see when she's going to join us, if you could, Doris or Isabel Kite, if you could let me know when she's in, that would be great. All right. So since this product has been co-developed by the National Child Stress Traumatic Network, you can find all the materials from this curriculum at the nctsn.org website. So the National Child Traumatic Stress Network, the mission is to raise the standard of care and improve access to services for traumatized children, their families and communities throughout the United States. And this is only one example of how we do that, by educating communities. So the Think Trauma curriculum has 4 modules. And in module 1, the one that I'm gonna show you today a little bit, it focuses on trauma and justice involvement. This module can be easily adapted to trauma and the population that you would like to target or focus on. In module 2, we focus on trauma's impact on development. Module 3 focuses on trauma in context and coping skills. And lastly, module 4 focuses on trauma and secondary traumatic stress, and also the importance of self-care. So when we talk about trauma, why this curriculum was developed? Why Think Trauma is important? It is important because it helps us to explain behavior and how this behavior is directly linked or connected to how we handle it, okay? How we explain behavior is directly linked to how we handle it. Trauma is really not an excuse for behavior, but oftentimes is an explanation for it. And this curriculum is important because understanding the impact of trauma gives us more tools to do our job, make everyone safer, and help youth, help people build healthier lives and better futures. Because after all, we all deserve to have a good life. So because we talk about trauma, we always start by giving a self-care alert, right? So oftentimes when we focus on trauma, we can be triggered, you know. It's not a very, it's a difficult topic. And it is truly important that we are very aware about how we are feeling and what sort of thoughts we have during the training and also after the training. So many times if anybody is triggered during the training, these are some of the recommendations that we have for all of us. We can step out and take a break. We can talk to someone we trust, or we can do something that can help us to regulate our emotions. So the learning objectives for Module 1 is to define trauma and describe how it differs from everyday stress. We are also going to invite the participants to view behaviors through a trauma lens. And also the last objective is to better understand the role of resilience and recovery in buffering the effects of traumatic events and promoting health and development. So here is a question that if we will be in the same room, I'll have some time to, to spend with you and have a conversation. But since this is a taste of the curriculum, and also since we are doing this by Zoom, I'm not gonna ask you the questions directly, but for you to think about, how would you define trauma right now in your own words? And what is it that makes something traumatic as opposed to just stressful? So think about this, try to reflect with all the knowledge that you have, try to answer these two questions. And now, I don't know how many of you have watched this movie. It came out in the 2000s. It's based in a real story, and it's called Freedom Riders. The reason, I love Think Trauma curriculum. I have been training on this curriculum for a number of years. And one of the things that I truly appreciate about this curriculum is that throughout the modules, you have, you're gonna see videos, and we try to make the activity as interactive as possible, because we know that we are working with adult learners who already have a very, solid life experience and professional experience, personal and professional experience that can really support the building of more resources towards understanding and weaving in more information about trauma and how we can continue exploring and learning different ways of explaining how trauma impacts the lives of the individuals, the families, the communities, and society at large. So I'm really hoping that this will work. Let's see if you will let me know if you can hear. Can you hear?
Well, welcome to Freshman English.
Yes. Thank you.
Okay, Brandy Ross, Gloria Eunice, Alejandro Santiago, Andre Bryant, Eva Benitez, Eva, not Eva. Ava. I have to go to the bathroom. Okay, make sure that you. Yeah, I know. Ben Nichols.
White man, hoping he's in the wrong room. You gotta get out of here.
Cindy Nibor. Right here. Is that correct? Jamal
Hey,
Hill.
what am I doing in here? So ghetto ass class got people in here looking like a bad rerun of cops. You know how
Are you Jamal?
Yeah,
Well, for some reason, they have you registered in this class.
man, that's some bullshit. It's the dumb class, cuz. Means you're too dumb. Man, said it to my face, cuz. I just did. You see what I mean? Dumb. Hey, man, I know you ain't talking to me.
Okay.
Look, homie, I'll beat that ass, homeboy.
Can you please sit back
Look, I got
down?
dope, I don't understand. That's why you're over there wagging.
Please sit back in your seat.
Look, your spot as good as gold. I don't know why you keep wasting your time coming to practice with the 2-year-old.
Excuse me, may I please get some help in here?
There. Thank you. Let 'em out of here. That's some bullshit.
So this is a part of the movie that I will recommend you to watch. And it showed us a little bit about behavior, right? This is what we are seeing. We're seeing kids who, in the eyes of many people, we could safely say that they are misbehaving, right, in school. By the way, these Freedom Riders, I mentioned that Freedom Riders movie is a movie based on a real story. And the teacher, that was her first day of school, brand new teacher, and really hoping that she was gonna make a difference and change the world with her calling. So as you can see, she was really facing a big challenge during the maybe a few minutes of her first class. So when we watch this movie, this part of the movie, what we are trying to sort of engage in conversation with our participants on what they had seen, what behaviors you see in this part, and in what ways are the characters in this story like the youth, if you're working with youth, you work with. And if you are, maybe you can relate some of their behavior with something that you watch here. And what beliefs do the staff in the clip have about these youth? What do you think that people who are more seniors in the school, what are the expectations of the students and what are the things that they believe about them? And then the other question that we would engage in talking and discussing about is, what do you believe contributes to the way these young people think, feel, and behave? What's impacting their behavior? What's impacting the way that they see the world, the way that they can relate to themselves and to others? So these are important questions that we will invite you to reflect on as we get more in depth with the curriculum. And remember that the first question that I ask is, what is trauma, right? And we are still trying to weave in the definition after we watch this part of the movie. So here is this teacher again. She not only survived, but she's thriving here in the school setting. Remember that Jamal, one of the students, was giving her 1 day in school, but she didn't quit. She continued coming. And she made it through the first parents' conference in her new school. But prior to this first parents' conference, she actually was trying to figure out how she could really earn the trust of her students and how she can help them improve their writing skill and their reading skills that were really behind, right, for their age and their grade. So she came out with the idea that in order for the students to write, she was going to bring them these notebooks that you see in front of here. And she bought them herself. She brought these notebooks. And when she brought them to the classroom, what she asked them to do was to take one and to write whatever they would like to. It could be poems, it could be their favorite songs, it could be parts of a magazine, or it could be their own stories. So she gave them some options, some choices that they could make on their own. And then she said, I don't really care about what you are writing. I want you to write. And if you want me to read what you wrote, then I'm gonna have a locker here where I'm the only one that has that can have access to it. You put it here, it's gonna be safe. I'm the only one that's gonna read it. And then, and then I can comment on it, right? So to her surprise, on her first parents conference day, what she did was she prepared herself with cookies and lemonade, and no parents show up. There was nobody there. But then she remembered that she had those notebooks, and she sort of checked the locker, and to her surprise, all the notebooks were waiting for her. And now what you're gonna watch is what type of stories were the ones that these kids share with her. Now, I want to tell you that the stories are hard to watch. So be prepared because, this can be triggering for some of us.
In every war, there is an enemy. I watched my mother being half beaten to death and watched as blood and tears streamed down her face. Felt useless and scared and furious at the same time. I could still feel the sting of the belt on my back and my legs. One time, we couldn't pay the rent, and that night he stopped us on the street and pointed to the concrete. He said, "Pick a spot."
I was my boy. He had my back plenty of times. He was like one fist, me and him, one army.
Yeah. The real estate right here. Nobody jumps it down. You gotta practice. Cause this our power. You shoot it, it's like your fault.
Sat there until the police came. But when they come, all they see is a dead body, a gun, and a nigga. They took me to juvenile hall. First night was the scariest. Inmates banging on the walls, throwing up their gang signs, yelling out who they were, where they from. I cried my first night. They never let nobody know that. Spent the next few years in and out of cells. Every day I worry, when will I be free?
My brother taught me what the life is for a young black man. Do what you have to. Help, deal, whatever. Learn what colors to wear. Gang battle. You can stay on one corner, can't stay on the other. Learn to be quiet. Wrong word can get you out.
You look in my eyes, I see a lot of wrong. If you look at my mouth, I see nothing wrong. If you pull up my shirt, you'll see the bruises. But then I bleed in something.
At 16, I've seen more dead bodies and more morticians. Every time I step out my door, I face the risk of being shot. In the outside world, there's just another dead body on the street corner. They don't know that he was my friend.
During the war in Cambodia, I had stripped away my father's dignity. Sometimes it tries to hurt my mom and me. Feel like I have to protect my family.
I was having trouble deciding candy at once. Then I heard gunshot. I looked down to see that one of my friends had blood coming out of his back and his mouth. The next day, I pulled on my shirt and got strapped with a gun I found in an alley by my house.
I don't even know how this war started. There's two sides that took each other way back. Who cares about the history behind it? I am my father's daughter, and when they call me to testify, I will protect my own no matter what.
Nobody cares what I do. Why should I bother coming to school?
Our friends are soldiers, not of war, but of the streets. They fight for their lives.
I hate the cold feeling of a gun against my skin. It makes me shiver. It's a crazy ass life. Once you're in, there's no getting out.
Every time I jump somebody in and make them a part of our gang, it's another baptism. They give us their life, give them a own. We have so many friends who have died in the undeclared war.
So here is here are real stories of kids who have experienced a lot of trauma in their lives. And maybe this is the first time that they are really relating the horrible experiences that they lived through to a teacher who was very willing to listen, and she had no idea that these were things that these kids were going through. So one of the things that we want to invite the participants from this curriculum to do is to reflect on, real stories through videos, and to think about what was your reaction as you watched the clip, and what events did you see that you consider traumatic. And the last question is, what types of traumatic events have the clients you work with experienced? Do you know? So when we are trying to learn more about what is potentially a traumatic event, we focus on 3 E's, okay? And the 3 E's are for events, experiences, and effects, right? So, trauma is the perception of danger, threat, and it's actually, it has a lot to do with, leaving something very dangerous that threatens your safety, or also being the witness of that, also being exposed to an experience that is very dangerous and feels or is perceived as a life or death situation, and also being part of our work that can also be conducive for us to listen to stories that are very that are full of threat or danger. So there are different ways that we can keep on building the definition of potentially traumatic events. So when we focus on events, we focus on the exposure to actual or threatened death, serious injury, or sexual violation. This is something that the DSM-5 just included. So it has not been long ago that this was included as a potentially traumatic event, a sexual violation. The other E with experiences is how a person experiences a potentially traumatic event can vary from person to person, right? Because it's all about also our perception. But with trauma, the event is experienced as harmful, something very threatening. And the other E for effects is that traumatic events can have short and or long-term adverse effects on a person's physical, social, emotional, and spiritual health that may show up immediately or later in a person's life. So what you can do, ask yourself, has the youth of the person you are working with experienced a traumatic event? And consider how experiencing a traumatic event impacts how youth or any other person who you are working feel in any context. It can be detention, or it can be in your outpatient setting, or it can be in the community, in a school, or any other social context. Now, for information for us, if we're talking about juvenile justice youth exposure to trauma, we know that 93% of juvenile offenders reported at least one or more traumatic experiences, and on average, reporting at least 6 with traumatic loss representing the most common exposure, right? So it's pretty common in youth who are involved in the criminal justice system that they will endorse traumatic events that have happened in their lives early on. And here are the percentages of what they endorse. About more than 60%, they endorse traumatic loss, separation, or bereavement. About 55%, they have experienced domestic violence as children. Emotional abuse is 50%, 40% physical abuse, community violence, 45%. So the percentages are quite high, and we can go on and on to the other different types. So why is important to become trauma-informed? Why is important to practice in places where, they include principles for a trauma-informed system? It is important, definitely, because unfortunately, it's pretty common, right? Trauma in certain communities and populations are more common than others. And SAMHSA proposes that there are different parameters that we need to include in order to practice, in order to ensure that whatever service we are delivering becomes a trauma-informed system. And the first one is safety. We need to make sure that the people who we serve feel safe in the environment that we are in. We need to establish trust. We need to figure out ways to empower the people who we served, to learn how to collaborate. We also need to figure out why it's important to form healthy peer support systems and also to become more trauma competent. And we need to include services that are cultural, historical, linguistic, and gender responsive. So I'm not sure if you agree with this statement that we learn by experience, right? And think about this. If you agree or not with this statement, we learn by experience. And if you agree, then imagine one day, one sunny day, not as cold as today, in where you are walking, you're trying to relax, and you're picking up, going to the forest, to a nice trail. You're walking nicely and enjoying the sun, and all of a sudden, you are noticing this snake, right? Automatically, your body and your brain reacts towards it. We are wired to be protective. We are wired to protect ourselves from danger. So there are physiological changes that happen in your brain and therefore in your body that will help you to survive moments, dangerous moments such as this. I don't know. And I'm pretty sure that there are people who will see this and they're not going to be afraid. But I am in the in the group that I'll be really scared. And so we understand that there is an amygdala in our brain, in our midbrain, that serves as an alarm center, which is going to be off. It's going to be activated. It's going to tell us, okay, you need to watch out because there is something here that you need to pay attention in order to survive. So, it's very serious. Your amygdala goes off and it really takes over. And it's now in a survival mode in your brain. So all that is focusing on is on surviving this moment, right? And therefore, there are some hormones that are being secreted so you can survive the moment, all right? So there is adrenaline rush that you will feel. So, you know, your heart will be pumping very fast and all the blood goes to your muscles so you can be ready to fight or to flee. You're going to escape, right? But you are gearing your body to do that. Immediately, this happens in a matter of milliseconds. And then, you know, there is the moment where you survive, and after you survive, then things sort of quote unquote go back to normal. So here you see here your body's preparing for action. There is a heart rate and blood pressure increase. There is the release of adrenaline and cortisol, because cortisol is going to help you not to feel pain if you decide to fight. Your digestion, you don't need to digest anything, right? So it slows down. So your parasympathetic system slows down because your sympathetic system is truly activated for good reasons. Your breathing rate increases, and you feel your muscles very much, you know, being ready, tense muscles now. So the next time that you go to the forest and, you know, you are walking peacefully and you see this, because we learn by experience, there is an immediate moment where your amygdala, your alarm center, will go off again. Because we learn by experience, you are going to remember that other event where you saw the snake. And for seconds, you are going to see this host as another threat because you might perceive this as a snake until you clearly see it again, and then you see that it's a host and you are no longer in danger, okay? So, and automatically when this happens, you know, your amygdala might react and you might feel some of the same sensations that you felt in the past with the hormones and the different changes in your body, but you might be able to regroup too quickly, right? So what we understand that if these events happen in isolation and there is nothing else that happens, then your alarm center learns how to reset quite easily. But if you are exposed to many different snakes at different unpredictable times, because we learn by experience, your alarm center is gonna grow to be super sensitive. And any little thing that would remind your alarm center about this type of danger will make your alarm center react and try to protect you, even when you don't need to be protected anymore. Even when all that you see are horses, your alarm center might not be able to make the difference quite rapidly. So we could talk more about it as we go along with the training. So one of the things that Think Trauma teaches us is how to understand how our brains work in front of stress and without stress. And we know that there are different parts of our brain that process different types of stress, right? So you see here the red part here, this is the amygdala, it's in our midbrain. And the amygdala has different functions. That's where we feel our emotions, but it also, for our purposes, we talk about our amygdala as our alarm center, okay? The important piece here is that here we have our senses. There are 5 senses that, you know, get through our brain and are processed. When we experience trauma, these senses also help us to sort of detect danger. It goes straight to our amygdala. Our sense of our auditory sense is the one that goes straight to the amygdala, you know, to detect danger. and the other 4 senses go through the thalamus, okay? Now, the thalamus is the one that secretes the cortisol and the adrenaline when our amygdala goes off. And here you see our hippocampus is the yellow part here. And here in our hippocampus, it acts like a filing center where we accumulate and organize all our experiences in this very good cabinet that it has all the good information. So these are all part of our midbrain. Here, the part in purple is actually our prefrontal cortex. And when we do, the prefrontal cortex here acts like our thinking center, where in here, what we do is we integrate information, we plan ahead, we come out with solutions. So this is the part of our brain that develops later on in our lives. For men, they say that it's close to the 30s when they reach 30 years old or so. And for women, it's more in their mid-20s, okay? So think about this, our prefrontal cortex is still in development in our 20s and 30s for some groups. And this is the one that really help us to press the brakes down when we need to, right? Think ahead, become less impulsive. So when we experience normal stress, quote unquote, normal stress, when our amygdala gets activated, it communicates easily with our hippocampus, our filing center, which in turn communicates easily with our thinking center, the prefrontal cortex, to come out with some solution to whatever is happening, right? So let's say that we are running late for work or late for a meeting, or any sort of daily stressors that usually pop up. The interactions between our amygdala, hippocampus, and prefrontal cortex are really in synchronicity when we experience some moderate stress. And therefore, when our prefrontal cortex comes out with a solution on how to face whatever we are encountering, then our amygdala gets the message that things are okay, that things are under control, and you can keep on living, you can keep on moving on with whatever your daily activities you are experiencing. But when our amygdala takes over and it truly figures that there is an extremely dangerous situation that we are facing, there is no communication with our hippocampus and no communication with our thinking center. So which means is that, our amygdala hijacks our brain, and hijacking our brain make us really be set our brain for a survival mode. And surviving means that we are really facing an extremely dangerous situation, and all that we are focusing on is to survive the moment, right? The problem, as I mentioned before, becomes really serious when our amygdala becomes oversensitive and continuously thinks that is facing danger when in fact there is nothing outside that merits the danger. And for that, there are many things that we can do in order to slow down our amygdala and to help our amygdala reset. So with our survival brain, we're seeing threat, we're remembering danger, we're preparing to protect. With our learning brain, we are controlling impulses, we're thinking through decisions and effective protection strategies. And that's the difference. Now, I am going to stop here because I just want to see if there are any questions this is the opportunity for us to, to give you a little bit of a taste of what this curriculum is all about. And I just wanted to show you some aspects of it. And I just want to see if you have any questions or any comments with the information that I shared.
Thank you, Rocio. I just want to point out too that our other speaker is here too. So Rocio, I mean, Doris has joined us, so.
Awesome, wonderful. Welcome, Doris.
Thank you. I'm sorry to be late. I was meeting with legislators and representatives and senators, so it took precedence. I'm very happy to be here. Thank you.
So Doris, maybe now I share a little bit of what Think Trauma curriculum can provide, but maybe you can also mention your experience. You are training on Think Trauma, and so just let participants know.
A little bit about me. I'm not sure what's out there about me, and a good, bad, and indifferent. But I am a person that was born with disabilities. I am a parent of children with disabilities. I'm a foster parent and an adoptive parent. I am a guardian ad litem. So for children in placement, I work with several communities, especially marginalized communities. As a Latina, I am a certified teacher, and I am a special education and disabilities advocate in the state and outside of the state. So this curriculum and this training was, it arrived at just the right time for me and for my populations and communities, where I've trained social workers, I've trained especially the mental health before. I'm sorry for all the for the mental health communities and providers that our marginalized children and youth are really experiencing prior to COVID. Before COVID, in Connecticut, we have over 4,000 children in foster programs and in mental health facilities. So this comes at a very prime time to reach not only social workers and providers, but also community leaders, parents. I've also trained foster parents and teachers, educators, and we've collaborated for the youth. I've had youth involved that have attended these trainings as well, because they've gone on to leadership positions and to become community health workers and peer workers in this movement. So if you have any questions for me, I'm willing and able for this. I am looking forward to also offering this training nationally and locally in other languages, especially Spanish, which is my dominant language. But thank you for the time, and I'm looking forward to working with all of you.
Thank you, Doris, for joining us. And I just want to say then, since there's so many people, if you just use the hand questions, if there are any questions, and just I do want to reiterate that this is just the overview. What we're hoping to do is in April, 4 sessions, and people will be required to stay from beginning to end, because that's the way that you actually do. So you're just getting a taste and an overview, but it is an amazing opportunity to get this. So we're very, really grateful to the opportunity to be working together. So please raise your hand so we can call on you. So for any questions, yeah, we're mindful of the time. We like to start promptly and end promptly. So yes. Okay, there is a question about the link for the full training registration in the chat.
I received a question. Would it be possible to get a list of resources when it comes to legal issues and mental health?
We'll be happy to look, as I explained at the beginning, we are part of a very large network. So what we will do is send out a request and see what is out there. So we'll be happy to follow up if you, you will see our information and our email on the presentation. So I'm also happy to put my email here and we'll see what we can find.
And between all of us, we have a large network nationally and locally. So there are many resources locally and nationally that we are very happy to share with you all during and after the trainings are completed. Absolutely.
Yeah, and also depending on what you are looking for, like there are trainings and information products for judges, for prosecutors, for lawyers, for defenders. The Think Trauma curriculum has been used for probation officers, correctional officers. So depending on the needs of the communities who you serve, we can definitely join forces and share the resources that we have available.
And one wonderful thing and opportunity with these trainings is that I live in the disability world. So with the IDD, developmental disabilities, and there is a trauma training also offered for that population. So there are many opportunities to connect and network after this training.
The MHCC also has materials about trauma. If you visit our page, we will find some of them. And for those who are Brazilian, we have a series talking about trauma in Portuguese. Please feel free to visit our page and always ask information that we need. It will be a good exercise for us here during the next 4 weeks that we'll be offering this training to offer and collect information from all of you. So the idea here is really to engage everybody, make this space a community space where we can share, we can learn it together. You can build something that will be available and necessary for all of us.
And I do see a question, a very important question about the dates. And yes, we have not put the dates because part of today's session is really to get a sense how many people will attend and commit. We do know that there are going to be 4 sessions, and I'm going to need everybody to make sure the dates are correct, but they are going to be on a so April, if anybody can confirm the list, I don't want to give the wrong information. I think it's on the 2nd week of April, April 11 and 13, and then the 25th, is that accurate? And the 27th, just to put that.
Yes, that is accurate.
Okay, great.
Yes.
So what we'll like to do is, if you can express your interest, we're going to put this information available now and see how many people will be interested in being part of 4-part training.
And
So
I can
again,
answer
it's
Andrea's
the
question.
11th. I'm sorry. Again, it's the 11th, the 13th, the 25th, and the 27th of April.
Yeah. And there is a question in the chat about if the curriculum is available in Spanish. And yes, it is available also in Spanish. So for the Spanish one, we don't have the dates. We thought about starting it in English, but that's something that you can reach out to Isabel Kai or Maria or Graciela, and hopefully we can put something together.
Yes, for sure. So we are offering in English and have a plan for our next steps offering in Spanish and maybe in the future offering Portuguese too.
Mhm. That would be awesome.
Yeah.
Graciela, you will have to lead that one.
Okay, well, so please stay. Okay, there's here. I see somebody that's interested. So it's great. We would love if you can just say if you're interested or people in your agency. We would love to hear from you. Okay, we see people there. That's great. So I am going to just turn it. Oh, great. Excellent. Turn it over to actually Isabel back. There's we really invite you to complete evaluation requirement. Is very simple and you will receive it via email. But Isabel, if you wanna, you can also scan it on directly from the chat. So, okay, great. You are getting a core group.
I have a question. I'm sorry because I can't get on or late. But are we collecting? Are we done? Okay. Are we collecting their information, their emails, and do we know how they came about our information?
Yes, it's all in the registration.
Wonderful. Okay. Thank you.
So thank you for joining today's event. We hope to see you at our upcoming Think Trauma training series. Our convening partner, the New England MHTTC, is funded by SAMHSA and required to evaluate their services. At the close of today's event, you will receive our evaluation survey. We appreciate your honest, anonymous feedback, which will provide information to SAMHSA and assist in planning future meetings and programs. Your feedback counts. For more information, contact the New England Mental Health Technology Transfer Center. Have a great afternoon.
Thank you to our presenters, and you will hear from us. We will send an email to everybody that attended today as a follow-up.
Thank you so much. Have a good day.